So we'll learn clinical anatomy of lower limb. What you need to remember, you have bones. You have 1, 2, 3, 4, 5 bones and 4 in your lower limb. How? 1 bone in your thigh, that is femur. After 1, what comes? 2. So 2 bones in your leg, that is tibia and fibula. And then 3 bones in your subtalar joint, those are talus, calcaneum and navicular. After that comes 4 bones, that is your 3 cuneiforms and cuboid. After that comes 5 bones, 5 metatarsals. Okay. After that again 5 phalanges. This is your proximal phalanx. Then again 5 distal phalanx and finally 4 distal phalanx and middle 5. Okay. So it is like 1, 2, 3, 4, 5 and 4. These were the number of bones. Now we'll come to the muscles. In muscles you will see that if I divide my thigh into 4 groups, front, back, medial and lateral. So how would I see that? Up it is thin. From ASIS it is going towards your patella. So it is thin and it is going like this. Same is behind, posteriorly. From ischial tuberosity, from thin it is going thick. So medial and lateral is vice versa. Above it is thick, low it goes narrow. Laterally also it is thick TFL and it goes narrow. Okay. So it will become something like this. So it is like this. From ASIS to patella, it is narrower above and wider below. And then this is your front and back is your hamstrings from ischial tuberosity to your tibia and fibula. And abductors and adductors, above it is wider, below it is narrower. Below it is lateral tibia, above it is your iliac crest. And for your adductors, above it is wider, that is your pubic ramus, and below it goes to medial tibia, which is narrower. So now if we start from the anterior group, we have vastus group here. So vastus has got lateralis, medialis, intermedius, and there is one muscle which crosses 2 joints, hip and your knee, that is your rectus femoris. So laterally it is vastus lateralis, medially it is vastus medialis, intermedius is in the center, and above that in the center comes your rectus femoris, which comes from your ASIS and goes down to your patellar tendon. So we finished quadriceps group, correct? Quadriceps is anterior, hamstrings is posterior, adductor group is medial, abductors are on your glutes, and side you have TFL, fascia. We'll discuss in detail. So we finished quadriceps group. Now if we come to medial, you have 2 boundaries. So first boundary medially after vastus medialis is your sartorius, which comes from your ASIS. After vastus medialis you have sartorius, which comes from ASIS and goes here to your medial tibia. Medial tibia has got one bursa. That bursa has got 3 tendons. 3 tendons. So out of that, first tendon is your sartorius. Okay. So sartorius comes from here. It attaches here. And here posteriorly we have hamstrings. Quadriceps has got 4 muscles. Hamstrings also has got 4 muscles. So hamstrings, there is one adductor group which is part of hamstrings, that is called as adductor magnus. So naturally adductor magnus has to be part of hamstrings. So it has to be posterior, near to posterior group. It cannot be far away. So the lower boundary of medial group is made with adductor magnus, and the anterior group is made, anterior boundary is made from sartorius. This is easy. Now sartorius, if I talk about adductor group, you have 2 small muscles. One is pectineus, which comes from your pubic ramus, and another is adductor brevis. Brevis means short, longus means long. So you have adductor brevis, adductor longus, and then you have one muscle between adductor longus and brevis that is called as gracilis. Gracilis is also a part of your pes anserine bursa. Okay, so one muscle sartorius which goes attaches to this E which comes from front. Then you have pectineus, then you have adductor brevis, then you have gracilis, and then you have adductor longus and magnus, medial group. Now we have understood our anterior group, medial group. Now we'll go to posterior group. Posterior group, we have finished one muscle of hamstrings, that is your adductor magnus. After adductor magnus, because this is medial aspect of posterior group, so you can remember like this, semimembranosus comes after adductor magnus. Semimembranosus, you can remember medial and membranosus, MM. So it is easy to remember. Semimembranosus, and then you know this is your femur bone. So laterally comes the biceps femoris, posterior group, which is part of your hamstrings, and in center comes tendinosus, semitendinosus. So semitendinosus is coming in the center. Then third part of your pes anserine E is semitendinosus muscle. Okay. So now if you see how it is posterior group, adductor magnus, semimembranosus, semitendinosus and biceps femoris. Now how it is, three muscles are going to your pes anserine. Now see the beauty. From anterior group, one muscle which originates from anterior, it goes to your tibia, medial tibia. Then second muscle which starts from your medial, it goes to your medial tibia. And then third muscle which comes from behind posteriorly, that also goes to your medial. Means see how beautifully it is giving protection 360 degrees. One muscle is coming from here, one is coming from here, and one is coming from behind. So how nicely it is taking care of your tibia and femur coming from all the directions. Correct? From anterior, from medial, sartorius is from anterior, gracilis is from medial, and then semitendinosus is from posterior. All three come together and attached here, and it is called as pes anserine. Okay, these three muscles are called as pes anserine. It is also called as goose foot. Now if you talk about the lateral aspect, you will find here, you will find TFL, tensor fasciae, and below this is your greater trochanter. Above greater trochanter is your tensor fasciae, below your greater trochanter is IT band, iliotibial band. Okay. Why it is called as iliotibial band? It is coming from your iliac region, it goes to your tibia. Okay, so iliotibial band, and this is your tensor fasciae. Now you will find tensor fasciae in between your rectus femoris in front. Rectus femoris starts from your ASIS, so from here till your gluteus medius muscle. Now if you come here, you will find gluteus maximus, medius and minimus, three muscles. Below that, let's see what and all muscles, all your muscles from posterior glutes, it is coming and getting attached to your greater trochanter. What are those muscles? Now above you will find piriformis. Just below piriformis, see you have superior and inferior gamellae, obturator internus and externus, and quadratus femoris. Now superior and inferior gamellae, there has to be somebody who separates them. Similarly, there is obturator internus and externals. There has to be somebody who separates them. So in between your superior and inferior gemellus, you have obturator internus, and in between your obturator see, these are four muscles. This is your superior gemellus, this is your inferior gemellus, this is your obturator internus, this is your obturator externus. Okay, so obturator internus and externus are separated by inferior gemellus. Superior gemellus and inferior is separated by obturator internus. Okay, and below this comes quadratus femoris, which is quadrangular in shape because it is coming, it is attached to your main region of your femur, so it is quadrangular shape. It is called as quadratus femoris, and this is your piriformis. Okay.